I'd had friends with diabetes growing up, but we only dealt with it from the outside, didn't understand much about it. When we first found out he had diabetes, he would be practicing or he would be helping work, and he would always have a headache or have some excuse not to be out there working, I thought. Turns out it was signs the whole time. When we were first in the ER, at that point we were just scared. Really, it was just, we were lost almost is what was going on. As soon as the people started coming in and talking to us and educating us, the better we felt. By the end, we were pretty confident.
Having a child with diabetes can be overwhelming, and we know that you have a lot of questions now that your child has been diagnosed. That's why we'd like to introduce you to your diabetes team, our diabetes program, what to expect while your child is in the hospital, and what happens after your child returns home. The Northeast Florida Pediatric Diabetes Center is a joint effort between Wolfson Children's Hospital and Nemours Children's Specialty Care. We are the only diabetes program dedicated to the care of children in all of Northeast Florida and Southeast Georgia. We have education facilities at Nemours Children's Specialty Care and in the Howard Building next to Wolfson Children's Hospital.
My name is Dr. Larry Fox. I'm the Medical Director of the Northeast Florida Pediatric Diabetes Center. Your diabetes team includes several pediatric endocrinologists who are physicians specially trained in the diagnosis and management of children and teens with hormone problems, including diabetes. Our doctors work alongside diabetes educators and a licensed clinical social worker to help you and your child understand diabetes and how to stay healthy.
Diabetes educators are specially trained nurses, dietitians, and other medical professionals that can teach people how to safely manage their diabetes. Children newly diagnosed with diabetes are often admitted into the hospital. Our diabetes educators will spend time with your child, along with you and other family members, to help you learn how to control diabetes. You can anticipate spending up to 8 hours over the next couple of days learning how to do things like recognize and treat low blood sugars, giving insulin and counting carbohydrates, and many more things. Our diabetes educators are always available to answer any questions that you might have and to help you manage any problems that may come up. So don't be afraid to reach out. We're here for you.
The more education we got, the better we felt. Every day we felt a little bit better.
I'm glad that we stayed. I'm glad we weren't rushed off for, like trying to make it quick and all that way we can get you out of here. It was much better for us.
Hello, I'm Erin Pfeffer, a licensed clinical social worker. Dealing with any chronic illness can be stressful, and diabetes is no exception. It can be especially tough for teenagers who are already dealing with the pressure to fit in and keep up with school, and now have added visits to the doctor, medications, and meal planning to handle. As part of the team, I can help your family find healthy ways to cope with the everyday challenges of managing diabetes. And I can connect you with other families who are dealing with diabetes. Also, if you ever have trouble getting insurance coverage or affording the things that are necessary for your child's health, please let us know. We're here to help with those issues too.
Hospital rounds start at about 8:30 in the morning. We know it's early, but it's really important that you and anyone responsible for your child's care be available so that our educators, physicians, and other staff can meet with you and answer any questions you may have. If your child is admitted to the intensive care unit, you will be working with the intensive care physicians and their team. Pediatric residents, who are physicians in training to become pediatricians, will likely be involved in your child's care as well. You will also see pediatric endocrinology fellows, who are trained pediatricians specializing in diabetes and other hormone problems in children. The residents and fellows are supervised by the pediatric endocrinologists, and they have an important role in your child's health. Your diabetes education will start as soon as rounds are over. Usually you, your child, and other family members will be brought to the Diabetes Center in the morning. All family members and other caretakers must be available at this time so that the education process can start and finish on schedule. While you're learning about how to manage diabetes, Your child may spend a couple of nights in the hospital, and it may be longer if your child is very ill and requires admission to the intensive care unit. The nurses in the hospital have a lot of experience caring for children with diabetes and do a wonderful job teaching as well. They will help you learn how to give injections and decide on the correct dose of insulin to give. They can also show you where to find movies about diabetes on your hospital TV's Get Well network. Participating in the education program can help your child and family get back home as soon as possible.
Discharge from the hospital depends on you being ready to start managing the diabetes at home. Blood sugars do not have to be perfectly in target range before you go home.
We recognize that it may be scary having to manage diabetes at home, but education prepares you and your child for self-management. After you go home, your education process continues. You'll have a follow-up education appointment at the Diabetes Center scheduled approximately 1 month after discharge. All physician appointments will be at Nemours, and the first clinic visit will be about 6 weeks after discharge.
Probably the most important thing that I got out of it was, nothing really changes. Your life doesn't change except you just have to plan.
Remember to bring your medicine. Remember to, if you're running out of strips, and that's the biggest thing.
Having a child diagnosed with a lifelong chronic condition like diabetes can be overwhelming, but we will do everything we can to make sure that dealing with diabetes becomes easier and just a part of normal, everyday life.
We are available during weekdays for assistance with your child's care, including helping with insulin dose changes, school issues, insurance problems, and more. You can always contact the Diabetes Center during regular business hours. During non-business hours, you can get in touch with a physician on call in case of an emergency. You can also reach out through the My Nemours patient portal.
I feel that we left here very confident, a lot more comfortable, knowing that, again, that we were not alone, that we could call them and we can call them now at any time. They were very amazing.
Just know that our Nemours diabetes team is here for you and will be helping you for many years to come.